Hi, my name is Carly Auer, and I'm a classical homeopath at Our Family Homeopathy in Mesa, Arizona. I have two children who have been raised on homeopathic medicine. Homeopathy has been such a gift in our lives, and I'm so happy today to be here to share it with you. I'm a graduate of the American Medical College of Homeopathy in Phoenix, Arizona, and on behalf of AMCH, we would like to welcome you to our new self-help homeopathy program. I invite you to visit us at selfhelphomeopathy.com. We have 30 different programs in a variety of topics, from acute back pain to cold and flu to autism spectrum disorders. The great thing about these programs is that in addition to focusing on a specific ailment, they also offer an introduction to general homeopathic and holistic medicine. So if you've ever wanted to learn about homeopathy and how it can help you, this is a great place to start. Visit us at selfhelphomeopathy.com.
Here is a brief clip from this program suggesting homeopathic remedies that are useful in treating this condition.
So there are three categories that I've broken down cold remedies into to make it a little easier to separate them out. The first category are the early stages and remedies that are most useful in the early stages of a cold. The second category are the middle stages. And then the last category are the later stages. And these are people who oftentimes have lingering colds that just don't seem to go away for one reason or another. Now, in the early stages, I broke this down into three primary or main remedies, and then I'll say a few words about some of the other more minor remedies for the initial stages. So the first remedy is aconite napellus or monk's hood. This is particularly useful when the fever is more high, also when their cold comes on very suddenly, with some violence. With aconite, there is typically more dryness and less perspiration. There can be great thirst for cold drinks, and there can be alternating chills and fever. It's probably one of the main remedies also for colds in infants. You can think of this remedy right away. What tends to trigger colds that need aconite is oftentimes exposure to cold wind. Also, some kind of shock or fear can trigger an aconite upper respiratory infection. There can be a lot of restlessness, difficulty sitting still, and a lot of pain that's associated in the joints with the cold. There also can be profound photophobia, sensitivity to sunlight, that can be troublesome for people who need aconite. And generally they feel hot. There's heat and burning, especially in the nose, and also a flushed face. Second main remedy for colds that is useful in the early stages is belladonna or nightshade. Again, like aconite, there tends to be higher fevers and a red flushed face. The discoloration of the face tends to be somewhat darker with belladonna than with aconite. Again, it comes on fairly suddenly. Typically, the time aggravation with belladonna is 3 p.m. or 3 a.m. Also, belladonna with their colds typically are worse with motion, and they want to stay still, and they're better from pressure. There can be also a lot of flushes of heat, like hot flushes, and the symptoms typically are much worse on the right side of the body. One of the characteristic symptoms of belladonna is that they feel like they have a hot, congested head, but the rest of their body is very chilly. And unlike aconite, they tend to be more thirstless than thirsty.